All right. Well, Dr. Wosinska, what are the facts when it comes to getting kids back to school? One of the pivotal issues, President Trump saying it is time, and his health secretary saying that the risks are overstated. Are they?
The risks aren't overstated, but I do agree that it's really important for the kids to get back to school. The question is not necessarily if they should be going back to school, but how to do it safely. I would draw a parallel to how we reopened. There are ways of reopening safely, and some states have shown that it can be done, and there are ways of reopening not so safely. And it's the same thing with schools. There are certain parts of the country where I think in-person education could very much happen. Think about New York, New Jersey, Delaware, and Connecticut. On the other hand, I cannot imagine schools reopening in person in Florida, Texas, or Arizona. Or perhaps they could reopen, but they would shut down very quickly because there's so much viral spread in the community that you would have students and staff getting sick pretty quickly.
Dr. Wosinska, I'm struck by this sort of certainty. You're saying that we know how to prevent the spread of the virus, and yet when I look into how the virus is spread, there still seems to be a lot of uncertainty, whether it is airborne or not, and the WHO's conflicting guidance there, the question of whether non-symptomatic individuals transmit the virus. Where are we on some of those basic ideas when it comes to the science?
Yeah, we definitely do know that asymptomatic transmission is really critical. And this is really what makes this virus so deadly, because people are making decisions that really don't account for the fact that they might be spreading the virus. And yes, I do agree that there is disagreement at this point as to whether it is airborne. But if we were to pursue we do know that being indoors really increases the risk. Poor circulation does matter. We know that social distancing, physical distancing does matter as well, that it works. We do know that masks are also very helpful if you cannot properly distance from other people. And again, because it's so much of the spread is asymptomatic, or pre-symptomatic, meaning before people have symptoms, these kinds of measures really can have a tremendous impact.
Professor, one thing I find fascinating here is one day this will be over. Do you think there'll be a permanence to our change of health policy, or do we just go back to what we were doing before?
So I would say that I don't know that this will be over. I think there's going to always be a new normal. I do think that this might become an endemic condition, disease. We might end up having to live with it, obviously not at the level that we live with it now. But it is possible that it might be something that we might need to get vaccinated for every year. The vaccine might not be 100% effective. We might not have a vaccine like what we have with measles, with very strong protective effect. So I think our old normal, which is I think what was the mistake in reopening and how people thought about what it would look like, we might never have the old normal again, even if we have vaccine and people are broadly vaccinated.
Does our health policy become more European-like?
That's hard to say, but I will say that with the level of unemployment that we're seeing, I think there are going to be questions asked about the employer-based insurance system. Where this will go, it's hard to say. But there are going to be changes also, I think, in how we might pay, even within our existing system, how we might pay. Fee-for-service has not worked particularly well during this pandemic because visits have really dropped. Elective surgeries have dropped. The providers that have been part of these newer models, ACO, type models have done significantly better and have been in much better position to withstand this shock. So we're hopeful that this will also be a change that will happen.